I am Dr. Narasingan, Vice President of World Hypertension League and Vice Chairman of the Lipid Association of India. I am really happy to get associated with WCCI 2023 at Mumbai. Let me now try to tell you something about the LDL cholesterol, which I had given a lecture here. Atherosclerosis is a preventable disorder. The lipoproteins, the lipids play an important role in not only in the initiation of atherosclerosis in the form of endothelial dysfunction, but also in the progression of atherosclerosis ending in clinical cardiovascular events. There are a number of studies like Mendelian randomization studies, molecular studies, biological studies, epidemiological data. What is important is to appreciate that those people with the familial hypercholesterolemia, both homozygous and heterozygous people, only the LDL cholesterol is the culprit for pushing them to an early premature coronary artery disease and death. The important evidence comes in favor of LDL cholesterol's role that is being played in atherosclerosis is from the randomized control trials which had used the statin. More the reduction that was witnessed in the primary prevention trials and the secondary prevention trials had gone to prove that the wonderful drug statin had shown the benefit not only in the reduction of cardiovascular risk but also in the mortality. So, statins are safe, efficacious drugs which had been tried in primary prevention trials. There are a number of primary prevention trials. The one thing that I should tell you is about the Jupiter trial, which had used the statin, rosuvastatin, in people without any cardiovascular disease, without diabetes. They had gone to prove that there is a good amount of reduction of LDL cholesterol to the extent of about 50% or 55%. Those people who received the rosuvastatin compared to placebo has shown a maximum reduction of the cardiovascular events as a primary prevention modality. There are a number of other studies which I don't want to tell, but clearly indicate that primary prevention strategy is good by giving the statin for people who are at risk or even who are having high levels of LDL cholesterol. The secondary prevention trials, I need to tell you about the heart protection study, which had actually concentrated in about 20,000 people where the simvastatin was used compared to the placebo. Simvastatin 40 milligram was used compared to the placebo. They had seen the good amount of reduction in the LDL cholesterol. The baseline LDL was 108, which touched about 70 milligrams. In fact, the investigators' heart protection study did not identify the ideal LDL target beyond which the benefits were not seen. So, ladies and gentlemen who are watching this particular video must realize that if you are reducing the LDL cholesterol to the extent of 70 milligram as per the HPS study, that is possible to get a maximum reduction of cardiovascular events. Based on this study, only ACC/AHA came out with the recommendation that people with a very high risk need to keep the levels of LDL cholesterol less than 70 milligrams. After that, we had witnessed with PROVIT study. PROVIT TIMI-20 study, which was conducted in ACS patients, clearly indicated that even people who reach the levels of less than 40 milligram, you see a response about 40% reduction in the cardiovascular even subsequently following myocardial infarction, again indicating that the statins are wonderful drugs. And in fact, there are a number of other studies including the ASCOT study, HALHART study, and then the people who were submitted for MIRACLE study. All the studies have indicated the reduction of LDL cholesterol, which has shown the benefits in cardiovascular events. So, both primary and secondary preventions. So, we need to keep the LDL cholesterol less than 100 milligrams in general population, keep the levels less than 70 milligram in those people who are at a high risk, keep it less than 50 milligram in those people who had an established atherosclerotic cardiovascular disease, people in whom you have stroke, you have atherosclerotic cardiovascular disease including the coronary artery disease or a peripheral vascular disease, or people with the diabetes with multiple disease. You need to keep the levels of LDL cholesterol less than 30 milligram as per the recommendation given by the Lipid Association of India. So, ladies and gentlemen, try to concentrate on the reduction of LDL for the benefit of your patients, to make them comfortable, to lead almost a normal life. Thank you very much for listening this video.